Let's move on to our next presentation. We're going to focus on team-based holistic healthcare. This will be discussed in a panel format by an esteemed group of practitioners from Cayman Medical. So we'll invite them up. Dr. Roland Talanow, he's a diagnostic radiologist and medical director. Dr. David Quinter, he's the clinical chief of concierge medicine and primary care. And Dr. Michael Boucher, they're going to show us how the continuity of team-based holistic healthcare provides improved patient outcomes. Gentlemen, I invite you, I hand over to you.
Good morning, ladies and gentlemen. Thank you very much for having me here. I would like to discuss and demonstrate together with Dr. Quinter and Dr. Boucher how a team-based holistic healthcare approach can improve patient outcome. So over the recent decades, and especially the last years, it has been shown that the team-based holistic patient care approach, starting from the diagnosis till the end of the treatment, has been actually recognized as the ideal healthcare model. So we all know that the human anatomy is pretty straightforward, the human physiology, but every individual has slight nuances. I sort of like compared with snowflakes. So when you look them at the distance, all look alike, but if you look closer and even under the microscope, you notice that snowflakes have certain nuances, which is the beauty in them. So therefore, applying a cookie-cutting medicine approach might not be optimal for everyone. So therefore, patient-centered care has been shown in recent times to be more efficient, and by approaching the individual physical and physiological needs through different means such as advanced diagnostics, in example, specialty MRI, which I will introduce in a few minutes, and a seamless teamwork and between patient presentation, diagnostic workup, and final therapy, then ideally leads to the optimal outcome. So part of the holistic approach is also the patient experience, which is, in my opinion, quite a significant part of the whole healing process. And the therapy, in my opinion, also starts at the doorstep to the clinic. So having a welcoming, generous, less intimidating appeal for the patient helps also with the whole treatment process. So privacy is also important, and of course, then, which I will come to in a few minutes, the whole, having all caregivers under one roof is important for efficiency, and then finally, like saving time and costs and patient satisfaction. So having a happy patient environment, special privacy zones, relaxation zones with like massage chair and all these nice things, these all help for the patient experience. So without even seeing the healthcare practitioner yet, so they should already have a sort of like a good experience, which helps with the following steps. So I just bring an example with a comprehensive pain center as an example for the holistic patient care approach. Usually pain starts as an acute pain, and either it goes away or it develops into chronic pain. And what does the patient usually do? Either going to a pharmacy, getting something over the counter, self-medicate, seeking a general practitioner, chiropractor, physiotherapist, or other healthcare provider. And sometimes more of the, like several of these. And unfortunately, these tend to be scattered in different places, and they don't know about each other. So everyone is cooking their own treatment plan, and that becomes suboptimal. That can lead, in the end, to long-standing pain, and which then can lead to depression, drug addiction from pain medication, and then in the end also to mental health problems. So having all these practitioners under one roof helps coordinating the therapy plan, finding even out what's the true reason of the pain. And the go-to person, the initial go-to person should be the family doctor, so the GP, family doctor, who then, after a thorough examination, then determines what should be done. Lab work, diagnostic workup, sending to physiotherapy or even chiropractor, or later on to a pain specialist if his basically workup exhausted. And if some mental health issues has been discovered, a direct referral to the mental health counselor. So, and as you can see in that diagram, it's important that everybody communicates with each other, because some might discover certain aspects which might be critical to the treatment plan from the other ones. So coordinating everything becomes more efficient, and that not only saves time, also costs, but also in the end helps the patient to recover much more quickly and living a happy life. So Dr. Quinter and Dr. Boucher will introduce themselves in a few minutes. I just want to quickly introduce the physiotherapy team, who basically have a wide range of therapeutic treatment plans, particularly for musculoskeletal and neurological disorders. Our chiropractor is more focused on the mechanical disorders, particularly spine. Our mental health counselor is important to break this vicious circle of chronic pain, depression, drug addiction, further depression, and even exaggerating of the pain. So that needs to be cut, and the mental health counselor has a vital role in that. So my role as a radiologist is literally giving insight by looking inside the human body, and diagnostics, especially diagnostic imaging and pain management plays an important role, and out of these, MRI plays a particularly crucial role, because it can determine if the patient can continue with conservative treatment or needs more invasive, aggressive treatment. So MRI has several challenges, and two of them I'm picking up, and which most of you might be familiar. It's the patient comfort. So traditional MRIs are narrow tubes, and it's difficult for particularly claustrophobic patients starting the study or even finishing the study. So there's a huge fall through in that population. That also affects the image quality, because they are nervous and shivering, and that deteriorates the image quality. For children, it becomes very challenging, because they need to be basically separated from the parents while being in that tube and that scanner, and they are deprived of many senses by having headphones, and that's quite frightening for a child, and so therefore they need, in many circumstances, especially when they are very young, anesthesia, full anesthesia. The second challenge is more physical in nature, and that is just based on the fact that the standard scanners are in a horizontal position, so they image the patient in a supine horizontal position. But as many of you who are a little bit middle-aged or older know, that back pain and any joint, knee pain, lower extremity pain, it's actually worse when you're standing, walking, moving, instead of laying down. So that might lead to underdiagnosis of the disease process. That can lead to basically under and or over treatment of the disease, which in return leads to excessive cost for the patient, but also to the society. And in the end, I mean, it's an avoidable patient discomfort, and the quality of life suffers for the patient. So that specialty MRI addresses these issues by being an open scanner. So having an open environment, it helps avoiding, in most of the circumstances, any kind of sedation. So we don't need any full anesthesia. Various situations, just a pill and then it's good. It's silent, so the patients don't need these headphones. We recommend having earplugs. So that fact actually helps that they can communicate actually with the MRI tech or whoever is accompanying them in that room. It's a more relaxing environment, because they can hear music, not over the headphones, but like regular throughout the room. The lights also help soothing them, and It has a higher safety profile because of its intrinsic physical differences compared to the standard scanners. And it's also comforting for the patient because there's direct contact to the MRI tech, and also loved ones can be sitting in the room and basically accompanying the patient. So that's our specialty MRI, which is basically a small compared to the traditional MRI. So only that area which needs to be imaged is in that basically a magnet, and the rest of the body is sticking out. So the patient can lay on that white table, look up, and basically enjoy the polar lights, these moving northern lights, and often the patients just doze away or even fall asleep. So another good thing is that the MRI tech, so the staff can be within the same room as the patient. There is a visual contact, and they can also talk to each other. So not through a microphone, not through headphones, but directly. And that gives the patient also a higher level of reassurance. And particularly for claustrophobic patients, for children, it's beneficial that the loved ones can actually sit there holding hands during the scan, and even with children, the dad can read the story while the scan is running. So that is a very, I think, positive experience for the patients. Another advantage is the added diagnostic value and functionality of that specialty MRI. So as mentioned, traditional MRIs are horizontal, and this scanner can also scan the patient in a horizontal position, but also in any kind of degree up to the complete upright position. So that brings significant advantages, and I want to provide you some examples. So the upper left image shows a supine MRI of the lumbar spine, and that right roundish area is the spinal canal. The dark dots are the the descending nerve roots, so that spinal canal is patent. When the patient is in upright position and we re-image the patient, we can see that on the lower image. You can see that there is a disc protrusion, quite a significant disc protrusion, causing some spinal canal stenosis, particularly that area where the nerve roots actually leave the spinal canal, so the lateral recess. So this is only seen on the weight-bearing portion, not on the supine. So there is this, actually, that is the reason why the patient came in the first place for the MRI, and this would have been missed on the supine imaging. So the patient would have potentially received the wrong treatment, and with all the cascade of consequences. That's another example of a weight-bearing MRI of the lumbar sacral junction. So we're looking from the side. The left image is the supine laying portion, where you can see there's some offset of the vertebral body. It's called spondylolisthesis. And under weight-bearing load, you can see that this distance widens. So this is an unstable spondylolisthesis, and it has basically a significant impact on the treatment plan. This is a knee MRI. The left image shows the same patient in a supine position, and the articular cartilage where the arrow is pointing looks normal, and under weight-bearing load, you can see that area becomes white. So that is a sign of cartilage damage. So that is only visible on that weight-bearing portion and not on the supine. So this would have been potentially missed, and the patient would have not received potentially the right treatment. Because of this open environment, the patient can move in many directions, and that enables us to do a dynamic MRI. So in this case, a shoulder MRI where we see to the left a neutral position, and then slowly the patient abducts the shoulder. So this, in this case, we can actually image the patient in a position where actually it hurts. So it makes sense to image somebody exactly in a position when it hurts to detect what's the underlying cause. Another thing which enables us is doing a in-motion MRI, which is basically a real-time video imaging, also a shoulder MRI where the patient abducts, and you can I don't know, do I have a laser? Oops, sorry. So you can see here this bony protuberance, which is scratching under the acromion of the shoulder. So that is the reason of the patient's pain. And if we would have done only a still image, just a standard sequence, this would have potentially not even noticed, not reported, and then nothing has been done about this because the rest looked pretty fine. So we can do, yeah, excellent. We can do any joint, any moving body region, including ankle, knee, hip, TMJ, cervical spine, wrist, to evaluate the function and the relationship of the structures while moving. So, go to the next slide. Although it's an open MRI, it demonstrates actually very good image quality comparable to 1.5 and 3T MRI. So in this case, the same patient has undergone a cervical spine in a 1.5 Tesla MRI and then did a follow-up in our specialty MRI. And you can even argue that the left one has more motion blur because the patient was anxious. So another example is a shoulder. In this case, the patient underwent a 3 Tesla MRI to the right and then decided to try the open MRI, and we can barely see a diagnostic quality difference. And what makes me particularly happy is that we can image pediatric patients without any sedation, no anesthesia, no sedation. So the youngest patients we scanned was 3 years old. This is a 5-year-old child, I think, who underwent initially, under full anesthesia, a 1.5 Tesla MRI of the brain. You can see an arachnoid cyst. And the parents decided to do the MRI then in our specialty MRI. And without any anesthesia, no sedation, nothing, just the dad read a story to the child during the scan or holding hands. We could do that scan, and you can see there is no significant difference in image quality, diagnostic image quality. Yeah? So, and I think last but not least, I would say that we should also, we are more, I think, considerate about the environment, and that scanner only uses a fraction of energy traditional scanners are using, so we're having a low carbon footprint, and that's our contribution a little bit to the environment. Thank you very much. I'm leaving it now to Dr. Quinter.
Good morning.